First of all, I want to thank Less Cancer for inviting me and giving me this award today. I am new to this arena because I'm not familiar with this organization until now. I've had to read a considerable amount of information to find out about it. But it's interesting, when I was invited from somebody from UVA, and UVA had just asked me to be on the external advisory board for their cancer center. So I was a little confused what was going on. But again, I'm very appreciative. My work has focused on breast cancer primarily. And I think it's really important to understand, as I focus on health disparities research, I want to sort of get to dismissing the inequities, getting to the equities. And that's been important by our patient navigation program. We have the Capital Breast Care Center, which provides screening for breast cancer, for mammographies, for everybody, particularly minorities and underserved individuals who do not have the ability to pay to be screened. But it's important when we talk about screening, because that's one of the biggest issues that we discuss in prevention. But if you can't follow the person all the way through, if somebody has an abnormal finding, you have to make certain that you seek all of the care that's needed, diagnostics, treatment, and more importantly now, we don't talk about adherence enough. You can get screened once in your lifetime, but that's not enough. You must continuously be screened according to the guidelines, whether you choose 1 year or 2 years, but you must do that. And those are messages that are often missed, which we are really pursuing. Another area of my focus has been on lifestyle interventions. I was so happy to hear about the bicycling and all that. I don't bicycle, but it was nice hearing about it. But mainly because I focus on energy balance, which is energy intake, which is the food that you eat, and energy expenditure, which you expend through physical activity. You try to come into some balance. And why is it important? If you look at the obesity epidemic that's going on, it's really pandemic worldwide. Obesity is linked to almost 30 cancers. So it's not about what people look like, it's about their health status. We want people to live longer. And if we know that the weight gain is associated with increasing risk for cancer, I want to do something about it. So what do? We do a lot of exercise interventions. And it is stated that by the American College of Sports Medicine that we should exercise 150 minutes a week, 30 minutes a day. I'm not going to ask anybody to raise their hand to say how often they exercise and how much they exercise. But the key is keep moving, keep moving. And when I heard the 275 miles, I said, no way, but that's a good idea. and often we blame people. We make people the victims. They're the people who are suffering, but we make them the victims. And I give it a good example. We heard about nutrition is important. People talk about nutrition, but the idea of what I say, weapons of mass expansion, McDonald's, Burger King, Popeyes, tacos, all the things we might want to have. But when you think about it, who do they market to? Where do you see this? Georgetown will not allow a McDonald's in that whole region of Georgetown. But, so that's good. But where do they allow it? They allow it in areas that people are unable to speak for themselves and defend themselves. And also, it might be cheaper to get a $1 sandwich. But the quality of the food is so important. So we deal with quality. We also deal with food deserts. There's certain people that don't have access to the food that we need, and the healthy food. If you go to Suburban Maryland, from this area, you might find the greens and the lettuce being sprayed with water. If you go to inner city areas, you might not find any of the vegetables. So there are really differences, and people have to understand we've got to figure out a way to address the inequities that impact the cancer. So we want to prevent cancer. It does involve lifestyle changes, and we always talk about tobacco. I'm not a tobacco researcher, but I can tell you one thing. Cigarette smoking is related to 500 million people will die each year from cigarette smoking. Now, that's not just you smoking. That also includes secondary smoke. So if you say, well, I don't smoke, so it's not a big deal. But people who smoke around you or near you can actually have an impact on you. And you see nowadays more women are developing lung cancer because they didn't smoke, but the people around them smoked. sudden infant death is associated with smoking. So the things are, we have to change our lifestyle behaviors, and those that impact us, even though we're not the ones at odds with it, we need to have a way to address that message in the community. So again, I'd just like to thank Less Cancer for this award, and I'm happy to be here today.
Doctor, before you, I know we're going to have a couple questions. Can you answer a couple questions for us? That would be great. Does anybody have a question for Doctor? Please, now's the time to ask, because we are, anybody ever here, any students? Oh, right here, I'm sorry. And stand up. What's your name?
My name's William.
Hey, William, my name's William. Oh. I like that. Glad you're here.
Yeah. I was wondering if you could speak to, there's a lot of vaping going on nowadays, and I was wondering if there's any studies that have come out to show any linkage with lung cancer or different strains or variations in that regard?
I do not focus on that area of research, but I can tell you one thing. Vaping is relatively new, and we know that when things are newly introduced, it takes time for us to see the impact. So a lot of young people are going to vaping. In general, the idea of any of these external exposures are
we're in luck today, because we do have somebody that knows a lot about vaping.
So you get that.
And so we are in luck today. I am curious about the food deserts. I'm from Detroit, Michigan originally, where not that long ago people would leave the medical center with a sick kid, and there was no grocery store to stop by, so they'd often have to get food from the liquor store, where food was frozen and there was nothing fresh. Today, that dynamic is changing. People are aware of it, but it's still it's a challenge. Can you tell us about any food deserts in Washington? Is this an issue for us right here in the Capitol?
Ward 7 and 8, particularly Ward 8, has really been impacted the most. There is one Safeway or Giant, one store for the entire ward. We're divided by wards. But you know that statement, water, water everywhere, and not a drop to drink?
Yeah.
Think about it. Harris Teeter, Whole Foods, places that cost your whole paycheck. Yeah. Those two, and they're right beside public housing in D.C., in Ward 6, near my Southeast office, my community office. So all these new food places are there. But there's still deserts. There's still deserts to people because they cannot afford to purchase.
Right.
You know, if you go into Whole Foods and you buy something, you come out spending $5, there's no chance. Mm-hmm. But you know, if you go into another store, the cheapest foods are the worst foods. Right. So DC has deserts in a different sense.
Right, I got that. And I will say, like Whole Foods in Detroit, which is now near that medical center I was speaking about, has a different way of pricing. And they have, you know, it's a way different model than what we see in the suburbs. But you're exactly right that access it can be right in front of you and you can't reach it for a whole lot of reasons, but mostly money. And it is, food makes all the difference.